Good afternoon and welcome to the Multicultural Media Online Conference hosted by the Ministry of Health, Multicultural Health Communication Service, and Multicultural New South Wales. It's a pleasure to have you with us today. I'm Jesusa Helaratne, Deputy Director of the Multicultural Health Communication Service, and I am your moderator for today and for these sessions. Unfortunately, the Premier for New South Wales, Chris Minns, Honourable Chris Minns, is not able to join us today as he has to attend to something urgent, but he will join us at another time. But we have, of course, Dr. Kerry Chant, Chief Health Officer, to answer all your questions and to give us updates. Hello, Kerry. Nice to see you.
Hello, how are you and how are you to your listeners?
Thank you, Kerry, for joining us. We begin by acknowledging the traditional owners of the land from which we all meet from today. We pay respects to elders past and present, and also pay respects to all Aboriginal colleagues and communities who join us today. We also pay respects to multicultural communities who are represented in this session. We also want to ask you to please send in your questions onto the chat. We know you have a lot of questions. Dr. Kerry Chant is here too. It's one-on-one with Dr. Kerry Chant. So please ask your questions. We want a very dynamic conversation and want to know what your thoughts are. We would like to request if you can keep your microphones on mute, but keep your questions coming. Now we'll start. Dr. Kerry Chant, thank you for joining us. Just a question about COVID-19. What are the numbers and how is New South Wales coping?
So now we're talking about COVID, but we've also got to talk about other respiratory viruses such as influenza and also a virus called RSV, which is respiratory syncytial virus, a bit of a mouthful. If we just summarize where we're going with each of those three viruses, and the reason we talk about those is that those are the viruses that tend to hit us from time to time throughout the year and can cause hospitalizations and severe illness. They all, so in terms of COVID, there's quite a lot of community transmission of COVID at the current time. So the level of community circulation of COVID is quite moderate to high. We have seen a number of hospitalizations, and our hospitalization level is sort of relatively stable, but at a higher level as we've gone through this wave. This wave has been a relatively flat wave, but this community transmission's been moderate to high. Influenza. So we did announce the start of the flu season many weeks ago, but what we've seen is a more rapid uptick over recent weeks. And so again, we'll be putting out a respiratory report tomorrow, and that will highlight a further increase in influenza activity. And RSV is sort of stable, but also present in the mix.
Dr. Kerry Chant, Kerry, what are the differences? I know RSV is coming up a lot. Could you just explain to us what RSV is for those who may not be familiar?
So RSV is a virus. It's spread in similar ways to the other respiratory viruses. It hits and affects particularly the very young and the very old. So we can sometimes see outbreaks in aged care facilities associated with RSV. It can impact anyone, any age, but particularly the very young. It can lead to a condition called bronchiolitis, which can lead to sort of respiratory breathing problems for young babies in particular, and that can lead them to require hospitalization. And as I said, it can affect every age group, but particularly we see it at the extremes of age. And similar with flu, influenza can be a severe disease across any age, but we're particularly concerned around our elderly and those with pre-existing health conditions, but also our very young. And one of our focuses this year is really to increase our uptake of influenza vaccination for our 6 months to 5-year-olds who are eligible for that free vaccine. And obviously we've talked a lot about COVID over the years. Again, we're most concerned for the elderly and those with pre-existing health conditions. But at this time, as we're going into winter, our key messages would be check that you're up to date with your vaccines. Now, I know that we've talked about vaccination for a long period of time, but the vaccination, the immunity or the protection afforded by the COVID vaccines does wane over time. And that's why to have that optimum protection, we're going to need to be up to date with the latest guidance. And so it is important that everyone checks that they're up to date. And we're particularly urging those over 65 years of age to have another COVID vaccine if they've not had infection or been vaccinated in the last 6 months. And anyone over 18 to 65 can consider, depending on their underlying health conditions, around having another booster dose.
I think that was a question by our community, and this is from Sue Advani. Is that the 5th COVID vaccine, and what is the take up among the age group, and how important it is for people to be, being up to date with that?
It's actually critical, and every piece of research that we're doing now, when we're looking at the protection afforded by the vaccines, we know that it wanes. The vaccines have been incredibly effective in assisting us against the more severe outcomes, but we know that immunity wanes, and we know that particularly those that are elderly and with underlying health conditions are most at risk of severe disease. And so it is going to be an ongoing sort of work with our clinicians, our communities, to really create awareness about the need for the ongoing boosters.
With the boosters, Dr. Chant, a lot of people are worried about, there's some concern in the community that taking both the flu vaccine and COVID vaccine together, and although we say it's safe, some people are still a bit scared.
I would rather you have the vaccines either together or separate if that's going to, but being vaccinated is the most key. I had my 2 vaccines. My husband's had my two vaccines. The 2 vaccines were practical. I only had to have 1 visit. It was easy and convenient. It can be given together, but if that is the thing that's holding you back getting vaccinated, my message would be just get vaccinated, and you can separate them. But they are perfectly safe to have together.
Some community members, and we've heard this across the board, that some are saying, look, I've had my 2 boosters. I'm not going to get other vaccination because I think I'm safe. I've had my COVID. What do we say to people who are saying that they don't need the vaccine at this time?
At the moment, we're really putting in the request for the elderly and those with underlying conditions. So particularly those that are over 65 years of age, there's a very strong recommendation to make sure that you have boosted. If you haven't had natural infection within the last six months, or a booster in that last 6 months. Similarly, if you've got underlying risk factors, it's important that you consider the benefit of vaccination. So unfortunately, the vaccine immunity does wane, and we know that the people that are at most at risk of severe outcomes from COVID now are the very elderly and those with underlying health conditions. And so our messaging is becoming more targeted to say that is the group that we're really focused on getting the information to support them make those decisions around vaccination.
And Dr. Chan, I think the question now is, and there's a lot of support as well, because they can go to their GP and they can also go to their pharmacist to ask the necessary questions and if they had any concerns.
That's right. It's been really amazing, the role of our primary health care practitioners, and that's across general practice or pharmacy. And please go online and look at it, whether your local pharmacy is offering the vaccination. That may be more convenient for you, but also when booking to see your GP. If you're elderly or you have underlying health conditions, we are suggesting that you get prepared for this winter, that you actually go along to your GP, check your medications, get your vaccines, but also talk to your doctor about if you get sick with a respiratory cough symptoms, flu, fever, type-like symptoms, what tests the doctor would like you to have, and what medication, if you happen to have COVID or if you happen to have influenza, what medication the doctor would like to do. So do that pre-planning ahead of you being in that circumstance, and that will make it a much easier for you to get prompt treatment, because we know, particularly for the elderly and those with underlying health conditions, having those timely access to antivirals is really important.
Thank you, Dr. Chant. A question by Boshra Alubaidi from the community. Is there any vaccine for RSV?
There's one in development, and you may have seen some various reports of that. So that's going to be on the horizon into the near future as that vaccine goes through its regulatory approvals and its clinical trials, and to understand when best to use it. But RSV will be, perhaps if we're having another discussion in 2024, we'll probably be talking more about RSV vaccine.
Thank you. The question about staying safe. Yes, there's being vaccinated here, but also when you're traveling overseas, that's a reminder. Should we be reminding people about, making sure they're up to date with the vaccine, but also other things in terms of diseases that they may catch overseas?
Oh, look, that's a really good point. I think everyone's looking, taking the opportunities as we've come out of the COVID pandemic to travel and reconnect with family, friends, or just for recreation. We're traveling across the world, and it's really important to understand the patterns of diseases in the country that you're going to and what are those risks. We've got a website on our Stay Healthy New South Wales Health, and that will give you some links to get to understand what sort of diseases or other health issues might need to be aware of if you're traveling overseas. Then there's guidance about making sure you've got a good medication supply. There's some general advice about staying healthy during the flight and other things to consider, but also around vaccines that you might need. And there's special vaccines that wouldn't be usually recommended in the Australian context, but if you're traveling to parts of the world where these diseases might be more common, that is when those vaccines are really important to have, and it's important to leave time. Vaccines, as we've talked to you about, take a while to work, so it's no good rocking up the day before you're about to get on the plane. So a little bit of planning, generally well before 2 weeks, at least I'd say a month. Get your planning ahead of your month ahead of your travel. Get those vaccines on board. And stay safe and have a wonderful time.
So, Dr. Chant, you're saying, so before I book my tickets, I should also put in my calendar when I get vaccinated.
That's right. You should book the trip, make sure that you've allowed enough time, and go and visit your GP or pharmacist and check and go online, make yourself aware of what are the things that you need to consider in that travel.
And I guess also, there are concerns of outbreaks overseas. So checking where you're traveling overseas, what are the concerns in terms of diseases and in terms of what you can bring back, and also your family as well.
That's right, Jess. And so when you go to your pharmacist or the GP, they'll be aware of the sorts of countries where there may be a chance of a disease outbreak. It's always wise to also just check immediately before you go, because sometimes situations can change, and there is good information put out around some of that local context in our websites, which link often through to Commonwealth websites.
Thank you. There's a question from the Australia Today by Pallavi Jain. Is there any chance of a lockdown happening again?
Look, I think it's really important to say that we've come through COVID. My message is that we need to continue to adopt those safe practices. COVID is still causing an impact on people's health, as does influenza, as does RSV, and we've talked about those. What our role now is really in terms of supporting people to have the information to make those healthy decisions, and support you to have ready access to testing, treatment, the things that you need to enable you to maintain that health. I think it's really important that we remember that some of those things that we have done keep us safe. So, for instance, stay at home if you've got coughs and colds, if at all you can. If you have to go out, put a mask on, and avoid crowded particularly indoor spaces. Make sure if you're eligible for antivirals, and what treatment and tests you should have, continue to use the rat test for diagnosis. But remember, even if they're negative, it may be that you've got flu or another virus, and again, you don't want to share that around. Particularly conscious of not visiting sensitive settings like aged care facilities or hospitals when you've got even the mildest of symptoms. We really want to keep our residents in those facilities as safe as possible. And the other thing was, mask wearing, making sure that if you're particularly older, or it's really important to you that you don't get COVID, really consider the sorts of environments you're going into at this time when there's a lot of virus spread around, and consider whether, you choose an outdoor seating area. All of those things will reduce your risk. So now we're talking about individuals making choices for themselves around how to keep themselves and their families safe. And so we also still have a lot of information on our website about just some of those prompts around how you can reduce your risk for you, but also your loved ones.
Well, that's a question here from Sumati Advani. Everyone seems to have taken their focus away from COVID. Many hospitals don't even require masks. Do overseas visitors required to prove their vaccination status?
Look, at this time when we're at the pandemic, people's vaccination status it isn't the critical thing. So no, that's not associated with your travel requirements. I've got to, though, say that the best thing you can do is be up to date with your vaccination. That's the safest thing for you. So again, we would, I think, all like a vaccine that gives us that long-lasting protection, that we only have to have one of them. But at the moment, with current available vaccines, we do know there is waning. Particularly important that older people continue to remain up to date with their vaccinations.
Thank you, Dr. Chant. And thank you for asking your questions. Please add in some more of your thoughts. Dr. Chant is here to answer your questions. And also you can see that our colleagues from the Multicultural Health Communication Service are sending through links that you can use for your community. Dr. Chant, there's a question here about the role of government and New South Wales Health playing in checking employers and staff if they're doing the right thing in terms of protecting the community as well.
Well, I think that we've now really not got any strong rules in place through mandates or sort of orders. We've moved well beyond that phase of the pandemic response. What we're moving back to is working with communities, working with individuals, and working with businesses to actually say that it's in everyone's interest to take those reasonable steps to keep everyone safe. So we're asking businesses to consider how their premises are ventilated, have policy, continue to encourage workers to stay off when they're unwell, consider the role of masks, making sure that we've got hand washing and those sort of facilities in place. So we're moving from a setting where there was more prescriptive rules to really saying we still have to follow many of those things that were put in place, were actually put in place for a good reason, but we as a community need to work together to say that we're all going to play our part and do those simple things. And I think that's been the focus of our narrative now, that there's actually some really simple things we can do that can actually reduce the transmission, reduce the spread of these viruses. And if we all play our part, it's also important that we understand that people may have different risks. So the person standing next to us in the shop, or the person, so just being mindful of that, giving them a bit of a distance. If they're wearing a mask, that they may, just taking a little step back, giving people distance, being thoughtful and not, looking at them in a bad way because they are wearing a mask. I mean, I think we just need to encourage people to take those protective behaviours and be very supportive, and we really call upon the communities to really get that care and compassion around and continue to do those little things to keep each other safe.
Yes. And there was that stigma about having COVID. Now everyone's had COVID and, wearing masks. And it is a responsibility to keep yourself safe and your family. A comment here is stay at home if you have symptoms is a moral responsibility, but work responsibilities often results in people going to work with symptoms, as you've said. And employers also look the other way. Are there any fines for those who ignore? Is that something that
No, look, health department is not there, and it's really very difficult in those circumstances. But clearly, there are occupational health and safety, framework that businesses have to respect. And also, I suppose I would say to business that having workers sick at work can actually be counterproductive if you have a number of cases coming down within your workplace. And so I think explaining to workplaces that having sick workers is not a good thing for the workplace is also a way of supporting us to keep each other safe.
Thank you. There's also diseases that are coming up. This is the meningococcal disease that's come up as well. What should we watching out for?
So look, the symptoms of meningococcal disease, look, let me start by saying meningococcal disease is a rare disease, and but can be very severe, and it can be hard to recognize, and it is important to know the symptoms, and some of them include, sudden onset of fever, headache, neck stiffness, dislike of bright lights, nausea and vomiting. Babies can be just not poorly feeding. We just really want to say, if you're feeling very, very unwell with some of these symptoms, always feel free to call Health Direct and get some advice, get some guidance about where you should go, or contact your GP. There are some rare diseases which can deteriorate quite quickly, and it's good to just recognise the fact that if you get those symptoms, you need to get prompt medical attention. So one of the sources would be ring your GP, get seen by your GP, or if not, talk to Health Direct, and they can take you through your symptoms and suggest what's the best pathway for you.
Thank you, Dr. Chant. And if you call Health Direct and you need language support, you can call TIS 131450 and then contact and ask for Health Direct. Dr. Chant, in terms of some of the diseases that are coming up, how should people be aware? I mean, mental health plays a big part in knowing that should I be conscious of a lot of diseases coming up. How should we be advising our colleagues, as well as you said, if people are sick, how should we be advising colleagues in terms of just keeping themselves safe and their well-being safe?
Look, I think I've talked to you before that we really need to re-engage with the things that keep us healthy. So in terms of, I know your question was around infectious diseases, but I'm going to answer it in a bit of a circuitous way. I think it's really important that we've all re-engaged with all the prevention activities that we're meant to have done. There's many prevention tests that we should have, our breast screen, our various cancer screens. It's really important that we engage in that sort of preventative behaviour. I think whilst we have to be aware that there's lots of influenza around and for other respiratory viruses, we actually are really well armed with knowing how they're spread and how to minimise our risk. So I think while we have to recognise people that might be unwell and get help and get care, and that's probably the message around meningococcal, as well as taking advantage of the vaccine that's available for one type of the for a number of types of the meningococcal. It doesn't protect against all types of meningococcal. I don't think we should be overly concerned around infectious disease risk. We're actually really well armed. Those basic messages of washing your hands. We know how to reduce the risk of respiratory. We know how to the importance of vaccination. So, and we just need to recognise when people might be very acutely unwell, and that's a time when you need quite rapid care antibiotics, and it could be meningococcal, but it could be some other forms of bacteria that can also similarly cause quite rapid deterioration. So they'd be my messages. Let's not be overly concerned. We're really armed with those tools. We know the importance of hand washing. We know the importance of those respiratory hygiene things. And we know if we can know how to recognize when ourselves or our loved ones are becoming very sick and get care quite quickly and recognize you have to get care quite quickly, then I think we'll keep ourselves safer during this winter season.
Yeah, and Dr. Chant, the messaging of, knowing if you're high risk or your family is high risk, and being informed with that so that you can be guided in the next steps.
That's right. It's really important to understand your risk, and across all of things, age is a really important risk factor. But please know if you are eligible for antivirals, please know the test that your doctor wants to have. Please be prepared this winter and have a plan.
There's a question from Bushra Alabaidi. Any idea about the number of deaths due to COVID and compared to influenza in the last 2 weeks?
Okay, so look, at the moment we have the deaths that come that are reported through the births, deaths and marriages. So they're actually delayed because it does take a while from when the death occurs and when it's notified. But we have actually seen, we report those figures every Friday, and they're collated as part of national statistics. And there has been a number of deaths associated with COVID. So COVID is still contributing to deaths, largely in older age groups. And again, that reinforces my message around the importance of being up to date, reporting the importance of getting antivirals as early as possible. But even with those interventions, COVID can still lead to death in that very vulnerable age group. Yeah.
You did mention, Dr. Chant, about we have all those habits that we've gained over the years, not just months, over the years, but also making sure that when you do plan for festivals or events, to keep that in mind in terms of celebrating outside and keeping ventilation.
Yeah, so the outdoor environments are wonderful, and it's been it's wonderful to see a lot of the celebrations the communities host are outdoor events. So they're fantastic. Again, when people are moving indoors, just keep those doors and windows open, as well ventilated as possible. And again, just the messaging ahead of festivals and major events where you're going to bring a lot of people together across all of the age groups, really getting those positive, supportive messages around vaccination and other things ahead of time. So I think the communities are pretty well armed with the messages, and it's probably, I feel a bit bad restating those messages, but they are important.
I've looked in the weekend and there are so many events. So when you look up, what am I going to do this weekend? I'm going to try to see, and you're wondering what events are you going to? But do I need to do my rat test? I think that's still the message that that's been asked. Do I need to do my rat test? What do I need to do when I do celebrate or when I do go out?
Well, I think my first message would be, make sure that you're not not going out and about when you're sick. When you're sick, if you have to go out, wear a mask, and really don't go into crowded indoor places. So let's just see if you can do those small things. We would recommend the use of rat test, particularly if you're going into high risk settings like hospitals, and you're visiting in hospital or an aged care facility, just as an added protection, particularly when there's lots of community transmission, or when you've been in contact with someone that's had COVID. So again, we're not recommending widespread use of rats when you don't have symptoms, but just think about how you can use them to reduce the risk, particularly of inadvertently coming into contact with someone particularly vulnerable when you haven't got symptoms. Because remember, the challenge with these viruses is we're infectious before we've got the symptoms, and that's the utility of the rat.
Dr. Chant, we've run out of time. It's 4:30. Were there any other things that you wanted to remind the community, or any other messages that you wanted to deliver to the multicultural media that's joined us online?
I just wanted to thank the community and also thank the media for the amazing effort. Thank you for supporting your communities. Stay safe, and thanks for bearing with me as we reiterate some of the messages, and hopefully there's some fresh messages in there.
We have one last question that we can take in. Rhonda Katan from Arab Council Australia. The PCR testing is still operating next to her at their office. Are they still available around the state or only in specific locations?
Okay. So look, what we have moved to is actually having the usual way to get a test, a laboratory test, is by having a doctor's referral. Now, the doctor can do that referral ahead of time, and that's why we're saying have a plan. So if you're, say, 80, living at home, pop down to your doctor to get your COVID and flu vaccine this season, but also talk to your doctor about having a plan. You'd be someone that we would want to get flu tested and to get tested for COVID. And if you are positive, we'd want you to get those antivirals. So having that plan, knowing what drugs you're going to be taking, having that all pre-done will actually really help you should you get infected over the coming months. So have that conversation. The PCR testing, that's how you naturally do it. Some of the private pathology companies are still operating, but there will be potentially a fee associated with that, an out-of-pocket. Whereas generally, the GPs will not be charging people for the pathology tests through the referral that you normally take to your pathology provider. But the other message is lots of rats out there. So there is lots of rapid antigen test kits that's being distributed. Please, no one should have challenges accessing them. Please, Jess, if you've got any ideas of where else we can send them, please let us know. We've written out to local councils, offering to local councils. Service New South Wales has also got rat kits that I know that a number of them are being distributed in other different settings across government. Please pick up one of those rat kits, have it on hand, and if that's positive, act on that. So if you're elderly and you've got a positive rat, act on that test. What we're worried about is sometimes it takes a few days for that test to turn positive, and that's why that PCR testing is really important, where you might have a negative rapid antigen test, have symptoms, and be eligible for those antivirals. Having that PCR test will get you those antivirals earlier.
Thank you, Dr. Chant. Thank you so much for joining us. We've had a lot of comments from the group and saying that thank you very much for the valuable update, and we should do it more often, and we will. Thank you very much, everyone. We really appreciate you joining us for today. And again, apologies from the Premier, and we'll get him next time. But for now, take care, stay safe, and we'll have the recording of this session for you. It'll be available on the New South Wales Multicultural Health Communication Service website. And if you have any questions or any other issues, or just some comments that you'd like us to address, please send an email and we'll get back to you. Thank you. Take care.